is Get Well 101. In today's live broadcast, we're going to be talking about H. pylori part 2. Yeah, we're talking about H. pylori part 2. And do not forget that whatever we say here does not constitute diagnosis, neither does it constitute treatment. Okay? So, what we do in Get Well 101 is to create healthcare awareness. Okay? That's what we do. And we also encourage you to go for your medical checkups. Very important. Okay? So, because we strongly believe in Gateway 101 that prevention is better than cure. So, we strongly encourage you to go for your routine appointment. Okay? So, we create healthcare awareness. That's our primary goal. We also create a simple home remedy to help alleviate symptoms. This is Get Well 101. Let's go for today's topic. So, in today's topic, we're going to be talking about H. pylori. We're going to be talking about H. pylori, short for Helicobacter pylori. Abbreviation is H. pylori. It is a type of bacteria that affects the stomach. It's one of the most common causes of stomach-related problems worldwide. I'll take that again. H. pylori is a type of bacteria that affects the stomach, and it is one of the most common causes of stomach-related problems worldwide. So think of it as a germs, G-E-R-M, that can live in the stomach lining and slowly cause irritation over time. It attacks the stomach lining and slowly causes irritation over time. Okay, so what does H. pylori do? H. pylori can damage the protective lining of the stomach and lead to chronic gastritis, that is stomach inflammation. H. pylori can damage the protective lining of the stomach and lead to peptic ulcer, also known as sore in the stomach or small intestines. So, in other words, H. pylori can cause stomach ulcer. It causes stomach ulcer with time, and also causes sore, in the simple language, sore in the stomach or small intestine. In some long-term cases, it may increase the risk of stomach cancer. Okay. How do people get H. pylori? Please kindly subscribe to Get Well 101. God bless you. Thank you for subscribing to Get Well 101. Please kindly subscribe. Okay. How do people get H. pylori? It spread merely through contaminated food or water, poor hand hygiene, close contact such as saliva or shared utensils. So you can easily get H. pylori through kissing. If you kiss your loved one and they have H. pylori, you can actually spread it through saliva contact. Utensils, sharing spoons, and other sharing plates and all that stuff, sharing food, you can actually contact it. And if you also have poor hand hygiene, you're not properly washing your hand, you can contact H. pylori. If you eat contaminated food or water, you can also contact H. pylori. Many people get infected in childhood without realizing it. So if you have a H. pylori, make sure your spouse is being tested. Okay? And I repeat again, if you have H. pylori, make sure your spouse is being tested because it is easy spread through saliva. One of the common ways you spread it, you kiss your loved one, you spread it. If they have H. pylori, you can actually contact it. Okay, so if your loved one, your spouse has H. pylori, tell them to let your spouse go text. Okay, because it is easy spread through kissing. Okay, common symptom of H. pylori infection. Please subscribe and like, subscribe and like, subscribe and like. Very important. Subscribe to Gateway 101. Some people have no symptom at all, but others may experience burning, stomach pain, okay, bloating, or excessive burping. There are some people they burp almost every minute they burp. Every minute they burp. Every minute they burp. Every minute, oh, oh, every minute they burp. Okay, those are some of the common symptoms of H. pylori infection. Nausea, vomiting is another common symptom of H. pylori. Loss of appetite, you don't have appetite to eat, is also common symptom of H. pylori. Unexplained weight loss is also a common symptom of H. pylori. Feeling full quickly, just take a bite and now you are full. You don't even eat much, you are full. It's a common symptom of H. pylori. Symptom of ulcer. Pain worse on an empty stomach. That is, if you wake up in the morning, you've not eaten, the pain gets worse. It's a symptom of ulcer, and it's a common symptom of H. pylori. Okay, so how is H. pylori diagnosed? How do you diagnose H. pylori? Doctor can test for it using breath test. Yeah, breath test is very, very common. Okay, they can also test your stool antigen test. They can also use that to test for H. pylori. Blood test is less accurate for active infection. Endoscopy with biopsy if ulcer are suspected. They can do endoscopy. Okay. So treatment for H. pylori. H. pylori is usually treated with a combination of 2 antibiotics. Okay, a protopump inhibitor (PPI) to reduce stomach acid may also be prescribed. So, but like I said, we don't prescribe anything for you here in Gateway 101. You got to see your personal physician to get your prescription, diagnosis, and treatment. Okay, treatment usually lasts between 10 and 14 days. So when should you see a doctor? When should you see a healthcare provider? So we strongly advise you to seek medical care if you have severe or persistent stomach pain. If you have a severe or persistent stomach pain, please seek medical help immediately. You are vomiting blood. Seek medical help immediately. You use stew, black terry stew, black terry stew. Seek medical help immediately. Unexplained weight loss. Seek medical help immediately. You having difficulty swallowing. You need to seek medical attention ASAP. Okay, so let's look about the best prevention tip, food that help during treatment, or how to know if your symptom will sound like H. pylori. So let's look into that. Okay, so let's make this upper clear and helpful. This upper clear and helpful. H. pylori is common, but they are great natural way to reduce your risk. Yeah, H. pylori is very, very common. The good news is it is treatable, but prevention is better than cure. So there are great natural way to reduce risk. Okay, support healing during treatment and recognize symptoms early will be of great advantage. So best natural prevention tip for H. pylori. Though H. pylori is a bacterial infection, often needing antibiotics, prevention is strongly linked to hygiene and gut health. Gut, G-U-T, gut health. Practice excellent hand hygiene. H. pylori spread through contaminated food, water, and saliva. So wash your hand before eating and wash your hand after eating. Okay? Wash after using the restroom. Wash your hand after using the restroom. It is spread through contamination of food, water, and saliva mostly. So teach kids good hygiene techniques early. Okay? And also drink safe water. Drink safe, clean water. In some area, contaminated water is a major source of H. pylori. Use filtered or boiled water if unsure of the source of the water you are drinking. Use filtered or boiled water if unsure of the source of the water you are drinking. Okay, and avoid unsafe street water when traveling. Avoid unsafe street water when traveling. Eat properly cooked food. Avoid uncooked meat or unwashed produce. Make sure you properly wash your fruit and vegetable. So we strongly recommend that you wash your vegetable and your fruit with vinegar. Very important. Soak them in vinegar and wash them properly. Okay, after a while you wash them before eating. So properly wash your produce. Very important. Wash fruit and vegetable thoroughly. Okay, and avoid food prepared in unhygienic condition. Don't share utensils often. Your spoons, forks, and eating plates and other stuff. Do not share them often because H. pylori can spread through saliva, as I've said that before. Okay, avoid sharing spoons, cups, and toothbrush. Strengthen your immune system. A strong immune system can help prevent severe infection. So strengthen your immune system by sleeping well, manage stress, eat antidotes rich food. Food that help during H. pylori treatment. We're going to be looking into that too. This food does not replace antibiotics, but they can support healing and reduce stomach irritation. This food does not constitute diagnosis or treatment, in that they replace antibiotics, but they can support healing and reduce stomach irritation. Best health food will be probiotic food, very important. Antibiotics can upset gut bacteria. Probiotic help balance it. Yogurt, yogurt with live culture. Kefir, Kefir. Kimchi, Kimchi. Those are some of the food, some of probiotic food that you can use, you can take during course of treatment for H. pylori. Probiotic may also reduce treatment side effects like diarrhea. Garlic. Garlic has a natural antibiotic effect, so fresh garlic in food is also encouraged. Garlic supplement. Ask your doctor if on blood thinner. So if you're taking a blood thinner medication such as Coumadin, you're on aspirin, any blood thinner, okay, if you're taking any blood thinner, make sure you consult your doctor before taking fresh garlic or garlic supplement. Okay? Broccoli. Broccoli is one of the best research food for broccoli is one of the best research food for H. pylori. So you can take broccoli if you are during the course of H. pylori treatment. This does not constitute treatment, but it's food that will help you. Because broccoli is rich in sulfur. Okay, may reduce bacterial activity and inflammation. So broccoli is very important. Honey, especially Manuka honey, has antimicrobial property. A teaspoon daily, if not diabetics. Okay? Green tea may reduce stomach inflammation. 1 to 2 cups daily, not too strong, is also encouraged during the course of treatment of H. pylori. Anti-inflammatory food. This help calm gastric and ulcer. Foods such as oatmeal, banana, sweet potato, olive oil, and green leaves are also encouraged during the course of treatment for H. pylori. Food to avoid, because this food might make symptoms worse during infection or treatment. Avoid food that irritate the stomach, such as spicy food, alcohol. This alcohol can irritate the stomach during infection or during treatment. Also, spicy food. Spicy food can also irritate the stomach. Coffee with caffeine can also irritate the stomach. Fried or fatty food should not be taken during course of infection or treatment. Soda with carbonate drinks should also be discouraged during the course of treatment. Acidic food such as tomato, citrus, if painful, should also be avoided. Okay. Then you can actually drop a comment called how to know if your symptom will sound like H. pylori. Here are some common clues. So drop a comment and let me know how your symptoms look like. Then I can better help discuss what your symptom is. So here are the most common clues. So symptoms strongly suggestive of H. pylori. If you have a burning stomach pain, especially when hungry, If you are hungry, you have this burning stomach pain. It's a strong system that suggests H. pylori. Okay, do not forget that this does not constitute treatment, diagnosis or treatment. Okay, we are just creating a simple healthcare awareness. So, if you have one of these symptoms, we strongly encourage you to seek medical help immediately. Okay, so just burning stomach pain, especially when you are hungry, is symptom strongly suggestive of H. pylori. Okay, frequent burping, bloating, or burping, you burp very often, is a symptom strongly suggestive of H. pylori. Nausea without clear cause is a symptom strongly suggestive of H. pylori. Loss of appetite is also a symptom strongly suggestive of H. pylori. You feeling full is a symptom strongly suggestive of H. pylori. Unexplained weight loss is also a symptom strongly suggestive of H. pylori. You have a history of stomach ulcer. Okay, history of stomach ulcer is also another strong symptoms. Okay, red flag symptoms. See doctor urgently. Okay, this is red flag symptom that you must seek a medical help immediately. If you have any of these, don't wait a minute. You are vomiting blood, seek medical help immediately. You have black terry stool, seek medical help immediately. You have severe stomach pain, seek medical help immediately. Sudden weight loss, seek medical help immediately. You find it difficult to swallow, seek medical help immediately. Okay, if you suspect H. pylori, the best information is stool. If you suspect H. pylori, the best confirmation would be stool antigen test or breath test. Okay, so but you can't. This test got to be done by the medical provider. Okay, so because system alone can look like acid reflux or indigestion. Okay, so uh, you need confirmation. So a test got to be carried on for the doctor to confirm that it is actually H. pylori or it's just acid reflux or indigestion. Okay, because they all have like a similar symptoms. So test got to be done. Okay. Okay, so let's look at um what let's look at let's look at just let's look at what is the pain like. Okay, if you can drop a comment like what is the pain like, upper stomach or middle burning. What does it happen most on empty stomach after eating or at night? So these are some of the things that you can drop a comment and we can help you, give you some suggestions. Do you have any of these symptoms? Bloating, lot of burping, nausea, vomiting, heartburn, loss of appetite, weight loss, black stool or blood, which is urgent. Okay, how long has this been going on? So drop a comment. Let me see how I can properly, help, give you some suggestive. But the main thing is for you to go to your medical provider and get properly tested. Okay, using the breath test or the stool antigen test. Those are tests that can be carried on with by the lab, and medical provider will be able to confirm whether it is H. pylori, indigestion, or just a heartburn. Okay, for the sake of you who are just joining, remember we always make a quick brush through for you to have an idea of what we'll be talking about today. Okay, so we're going to go through it again. We're going to go through it again so that you can better understand what we are saying here tonight. Okay, we are talking about H. pylori, a short term for Helicobacter pylori. It is a type of bacteria that affect the stomach. It's one of the most common causes of stomach-related problems worldwide. I would say that think of it as a germ that can live in the stomach lining and slowly cause irritation over time. So I will talk about what does H. pylori do. We say that H. pylori can damage the protective lining of the stomach and lead to chronic gastritis, that is stomach inflammation. H. pylori can also lead to peptic ulcer, which is sore in the stomach or small intestine. In some long-term cases, it may increase the risk for stomach cancer. We also said that how do people get H. pylori? I would say that it is spread mainly through contaminated food or drinks or water, poor hand hygiene, close contact as like saliva or shared utensils. I would say that if your spouse is having H. pylori, is diagnosed with H. pylori, you also have to be checked properly. You also have to be tested for H. pylori because it is shared through saliva. It can also be spread to saliva. Okay, I would say that the common symptom of H. pylori infection will be some people have no symptom at all, but others may experience burning stomach pain, bloating or excessive burping, nausea and vomiting, loss of appetite, unexplained weight loss, feeling full quickly. The symptom of ulcer, pain worse on an empty stomach. How is H. pylori diagnosed? I would say that doctor can test for it using the breath test, very common, stool antigen test, blood test, breath test. That was what I first said. Breath test, BREATH. Breath test. It is the most common test they might do. The doctor can also do stool antigen test, which is more accurate. Blood test less accurate for active infection. Endoscopy with biopsy can also be done if ulcer are suspected. Okay, treatment of H. pylori is usually treated with the combination of two antibiotics. While this does not constitute diagnosis or treatment, we strongly encourage you to seek a medical help or see your personal provider. So H. pylori is usually treated with a combination of two antibiotics, a proton-pump inhibitor, PPI, to reduce stomach acid. Treatment usually lasts from 10 to 14 days. So when should you see a doctor? We say seek a medical care if you have severe or persistent stomach pain. Seek a medical doctor. You are vomiting blood. Seek medical help. You have black tarry stool. Seek medical help. Unexplained weight loss. Seek medical help. Difficulty swallowing. You need to seek medical help. Okay? I will also talk about some natural preventive tip for H. pylori. The best natural preventive tip for H. pylori, even though H. pylori is a bacterial infection, often needing antibiotics, prevention is strongly linked to hygiene and gut health. And I will say that gut is GUT, gut health. To practice excellent hand hygiene. H. pylori spread through contaminated food, water, and saliva. So wash hand before eating and wash your hand after eating. Wash your hand after using the restroom and teach kids good hygiene early. Drink safe, clean water. Drink safe, clean water. Okay, in some area, contaminated water is a major source of H. pylori. So use filtered or boiled water if you're not sure of the source of the water. Avoid unsafe street water when traveling. Eat properly cooked food. Avoid uncooked meat or unwashed produce. So wash fruit and vegetable thoroughly. I would strongly encourage you to soak your fruit and your vegetable um, with vinegar, then properly wash it before eating. Okay, avoid food prepared with unhygienic, unhygienic condition. I mean to say, sorry. Okay, so don't use utensils often. Don't share it. I mean, don't share your spoons and cups and all that stuff. And do not avoid sharing spoon, cups, and toothbrush. Strengthen your immune system. A strong immune system may help prevent severe infection. So get a lot of sleep, manage stress properly, eat antidote-rich food. I will also say that food that help during H. pylori treatment, we said this food does not replace antibiotics, but they can support healing and reduce stomach irritation. Food are such as probiotic food, very important. Antibiotics can upset bacteria. Antibiotic can upset gut bacteria, but probiotic help balance it. I would say that food like yogurt with live culture, kefir, and kishi. Probiotic may also reduce treatment side effects like diarrhea. Okay, so I would say that garlic has natural antibiotic effect. So fresh garlic in food will be also helpful. The garlic supplement, ask doctor if you're on blood thinner. Okay, broccoli is also one of the most researched food for H. pylori because it's rich in sulforaphane. It's rich in sulfur. It also may reduce bacterial activity and inflammation. Honey, especially Manuka honey, is also good because it has antimicrobial property. 1 teaspoon daily, if not diabetics. We also encourage. Green tea may reduce stomach inflammation. 1 to 2 cups daily, not too strong, may be of great benefit. Okay, anti-inflammatory food help calm gastric and ulcers, such as oatmeal, banana, sweet potato, olive oil, green leaf. Those are anti-inflammatory food which can help calm gastritis and ulcer. Food you must avoid that makes symptoms worse. So during infection or course of treatment, avoid food that will irritate the stomach, such as spicy food, alcohol, caffeine with coffee with caffeine, fried or fatty food, or food should be avoided. Soda and carbonated drinks, because this can irritate the stomach. And acidic fruit like tomato, citrus, if painful. How to know if your symptoms sound like H. pylori? But remember what we have said, that this does not constitute diagnosis or treatment. We encourage you to see your medical provider if you're having any of these symptoms, because symptoms strongly suggestive of H. pylori will be burning stomach pain, especially when you are hungry, frequent burping or bloating, nausea without clear cause, loss of appetite, feeling full quickly, unexplained weight loss, and history of ulcer. Okay, these are symptoms strongly suggestive of H. pylori. The red flag will be see a doctor urgently. If you have any of this, don't wait. You vomiting blood, black tail stool if you are not taking iron pill, severe stomach pain, sudden weight loss, difficulty swelling. Okay, so the best test to confirm H. pylori is this two antigen test or the breath test because symptoms alone look like acid reflux or indigestion. Okay, so we said that if you are, I mentioned some of the symptoms, and I said if you have any of those symptoms, please seek medical help immediately. Please kindly subscribe and like this channel. Subscribe to Gateway 101 and like this channel. Okay, while this does not constitute diagnosis or treatment, we are creating a great healthcare awareness to the community. Okay, so to come your way again, this is Gateway 101. Thank you all for watching. Stay blessed. Bye for now.